everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today I'm going to be discussing a medication known as Naratriptan. Its brand name is Amerge. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Naratriptan works by activating receptors 5-HT1D as well as 5-HT1B in intracranial blood vessels. The end result of this would lead to vasoconstriction. In terms of indications for use, Naratriptan is indicated to be used in the acute treatment of migraines. Now, before somebody was to use Naratriptan, there are some contraindications they should clear, as well as some precautions and warnings they should be made aware of. It would be contraindicated in patients who are using ergotamine or ergot-like medications. After the patient stopped using those other medications, the contraindication would still stay in place for 24 hours. It would also be contraindicated if a patient has used another hydroxytryptamine agent in the past 24 hours as well. It would be contraindicated in patients who have ischemic coronary artery disease, and it would also be contraindicated in patients who have vasospastic coronary artery disease. Patients with pre-existing hemiplegic or basilar migraines cannot use Naratriptan because they would put themselves at an increased risk of experiencing a stroke. Patients with severe hepatic impairment cannot use Naratriptan. Patients with a hypersensitivity to Naratriptan or any other component of the product would not be able to use this medication. Patients with ischemic bowel disease or uncontrolled hypertension would also not be able to use Naratriptan. It would be contraindicated for patients who have severe renal impairment, as well as peripheral vascular disease. Patients who have had a recent stroke or transient ischemic attack should not use Naratriptan. And the last contraindication would be in patients who have Wolff-Parkinson-White syndrome or arrhythmias that are attributed to conduction pathway disorders. In terms of precautions, patients should be made aware that arrhythmias have occurred with this medication, and in some patients it has happened within hours of receiving a dose. They should be made aware that elevations in blood pressure have occurred, and in some situations it has led to a hypertensive crisis. Some serious cardiovascular events have been reported, such as myocardial infarction, in patients who don't necessarily have coronary artery disease. For this reason, some physicians choose to give the first dose in a supervised setting. Cerebrovascular events, such as subarachnoid hemorrhage or stroke, have also been reported. For this reason, it's important that if a patient goes to a physician with migraine symptoms, that other causes of this migraine are ruled out. Coronary artery vasospasm has been reported in patients who have used this medication as well, and this is also in patients that don't necessarily have a history of coronary artery disease. Serious hypersensitivity reactions have occurred, such as anaphylaxis or angioedema. Patients should be made aware that medication overuse headaches have been reported with Naratriptan. Patients should be made aware that serotonin syndrome may occur with the use of Naratriptan. Patients would be at an increased risk of experiencing this syndrome if they were using other medications that affected serotonin levels. And lastly, patients should be made aware that vision loss has occurred, including partial significant vision loss. And once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Naratriptan, they can expect to receive their dose in tablet form. So if a patient was to use Naratriptan to treat their migraine, they would use 1 or 2.5 milligrams once they notice symptoms. The dose can then be repeated after 4 hours just one time. The maximum dose would be 5 milligrams in 24 hours. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Naratriptan, so I'll list some of those here now. Nausea can happen up to 5% of the time, and about 2% of patients notice dizziness. Somnolence and fatigue come in at about 2% as well. More rare but serious side effects would be stroke, myocardial infarction, anaphylaxis, ventricular tachycardia, or serotonin syndrome. That's all we're going to talk about today with Naratriptan. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.